technological advances have dragged healthcare kicking and screaming into the modern age. Since HIPAA in 1996, we've seen all health records go electronic, the imaging suite get computerized, and the introduction of multiple monitoring devices per patient. More recently, the breakneck speed of change has gotten even more ludicrous. Now, the average hospital has a dozen connected devices per patient, remote surgical robots, and an army of highly advanced connected imaging machines. Welcome to the terrifyingly insecure world of modern healthcare. Hello, my name is John Nye, and I'm the Technical Product Manager and Resident Tech Evangelist for IoT Secure and our IoT security appliances. Before getting too far into this, let me tell you why you should even listen to me. I've been an InfoSec professional for a decade and a half, and during that time, I performed countless security assessments for both employers and clients' networks. And these assessments were completed for organizations of every size in all the major industry verticals. I even spent 5 years of that time testing healthcare networks almost exclusively. It didn't take me long to realize that all these assessments were virtually identical. No matter the network I was assessing, the vulnerabilities and issues I discovered were usually the same. It was even worse when I had to return to a client and could have easily just turned in the previous year's report with today's date. It drove me insane. I got into offensive security to make things better, not give people false hope. So I decided to try and raise awareness, and I dreamed up this series. This episode of FUDIoT is all about the risky behavior of modern healthcare in the form of biomedical devices. Biomedical devices are defined by the World Health Organization as any medical instrument, apparatus, implement, machine, appliance, implant, reagent for in vitro use, software, material, or other similar related article intended by the manufacturer to be used alone or in combination for medical purposes. That definition leaves a lot of room for devices and other implements to be categorized in the biomedical category. Meaning, this could include anything from Da Vinci surgical robots and pharmacy dispenser cabinets to infusion pumps and other connected medical devices. But this category can also include implanted things like surgical meshes and devices like stents, pacemakers, and glucose monitors. Now, all of the things that fall into this large category have the potential to cause patient harm, leak data, or be the root cause of a network's breach.
He uses useless virus scans, dated servers, and security software that runs on Windows 98.
But today, we're most concerned with all the networked endpoints that get labeled as biomedical devices. Walking through any modern medical facility, you'll quickly find dozens of connected devices that do all kinds of things to keep the hospital running smoothly, as well as keeping patients safe and well taken care of. These devices are not inherently bad or flawed. The primary problems are a direct result of labels and categorizations these devices are given. Most healthcare organizations have different policies, rules, and even people that manage and maintain these devices. Often, the non-traditional IT devices are managed by facilities or maybe a dedicated biomedical team. The big issue is that these devices, like any connected device, are endpoints. Let's quickly discuss endpoints because it seems to be a point of confusion for many. An endpoint is very easy to define. It's any device that is physically an endpoint on a network. In other words, if a device can request a DHCP lease or be assigned an IP address, it is an endpoint, just like laptops and servers. You know, the systems that have entire teams that spend all their time managing, maintaining, and securing them. It is crucial that everyone stop differentiating these devices, or security will never make any progress. So from this point on, anything with an IP address should be thought of in the same way as more traditional endpoints, like your servers. Now, we've discussed the issues with management and labeling these devices as non-computers, but the problems don't stop there. Let's take a brief look at the modern imaging suite. In most healthcare facilities, there's a wing or a section of the building that is dedicated to medical imaging devices. Things like X-ray machines, MRI and CT scanners, and other large, complex medical imaging devices. As these devices have become more advanced and connected, they have also become exponentially more expensive. When one walks into the MRI room of the imaging suite, they are not looking at a $10 million machine the hospital purchased and maintains. No, they are looking at a leased machine that is owned and maintained by the manufacturer or a third party they've hired to maintain their equipment. So despite the fact that these complex endpoints probably run vulnerable operating systems and use default passwords, it is far more likely that they are just sitting there vulnerable because the hospital's security staff has literally no control over these devices. This same story plays out for the entire imaging suite and for a large swath of the rest of any medical facility. All these devices take the phrase unmanaged device and add a few hundred gallons of fuel to the flames by not even allowing security management. So now you've got a network that is full of connected biomedical devices managed by non-IT team that are likely vulnerable. And on top of that, you have an entire wing of the hospital filled with expensive endpoints that can't be managed. What you end up with is a network full of unpredictable and unstable devices that are either completely unmanaged or barely managed at all. This is the perfect storm that keeps most healthcare facilities hovering somewhere between major medical record breaches and ransomware threats. How do you manage the non-traditional devices on your network? Is it just a matter of luck that you haven't been compromised yet? Are you even sure you're not compromised right now? If, like most of your peer organizations, you need help, then IoT Secure has a solution for you. Our IoT security appliances are designed from the ground up to find and inventory your unmanaged devices, with the added bonus of providing you with complete and accurate inventories of all your network devices. All of this without needing software agents or network tap span ports. Our solution is not just good at inventorying your endpoints. It will help you manage and secure your unmanaged devices. Things like IoT, biomed, OT, IIoT, or any other kind of network connected devices. If you want to keep uninvited malicious actors off of your network and your connected devices, all without needing to tune and spend far too much time and money, then IoT Secure is the right solution for you. Thanks for watching, and don't forget to like and subscribe. It helps the YouTube algorithm spread the word. If you'd like to learn more about IoT Secure, we'd love to hear from you. Go to iotsecure.io and learn all about our IoT security appliances, set up a demo, or even try our solution on us.